If you've decided that your baby will enter the world via a traditional route, it can help to know exactly what's happening during your vaginal delivery.
Delivering your baby is a rush, but it can also be a little bit scary. Remember that babies have arrived vaginally since the dawn of time. The first-time mom can expect to labor for about 14 hours, while repeat moms tend to take around 8. But because labor can last a few days, it helps to be prepared. Childbirth begins with labor, a 3-stage process. The first stage of labor has 2 phases, latent and active phase. Latent labor is the longest phase and can last up to a few days. During latent labor, your cervix will dilate about 3 centimeters, a process that results in mild, brief contractions which are spaced 5 to 20 minutes apart. Your amniotic sac may rupture now, but it's more likely that your water will break once you're in the hospital. Expect to notice discharge, known as the bloody show, and to experience backaches and cramping. At the end of latent labor, the active labor phase begins, and you'll head to the hospital. During active labor, which usually lasts for several hours, your contractions will strengthen and occur about every 3 minutes. Try to stay as comfortable as possible during this period. Don't be afraid to ask for a back rub or for help walking through a contraction. During the active phase of labor, you'll start your breathing exercises if you plan to use them. If you're having a medicated birth and have not yet done so, you might ask for pain relief now. At this point, your cervix will open past 4 centimeters and labor will quicken. The result is very strong contractions which last around a minute and are spaced quite closely together. This part of labor can be very intense, and you may experience nausea, fatigue, chills or sweats, and strong pressure in your lower back, pelvis, and rectum. Once your cervix is fully dilated to 10 centimeters, it will be time for stage 2 of childbirth, the delivery. To push your baby through the birth canal, a process that can take 60 minutes to several hours, you'll get into your preferred birthing position. Following the instructions of your doctor, you'll push as if you're having a bowel movement with each contraction. And don't worry, your bowels and bladder may empty, or you may vomit, and that's normal. Soon, your baby's head will appear, or crown. Once the head emerges fully, your doctor will suck mucus out of your baby's nose and mouth, and then guide him or her the rest of the way. The umbilical cord will be cut, and your baby will be in your arms. But you're not done. It's time for stage 3 of childbirth, delivery of the placenta. This usually doesn't last longer than 20 minutes and is accompanied by mild contractions. Once the placenta is delivered, your doctor will stitch up any tears and you'll be free to nurse and cuddle your new arrival. Congratulations, Mom!